So what we're going to do next is I'm going to go and examine your knee. And so, if you don't mind, I'm going to pull this up here, and we're going to take a close look at your knee here. Okay, and we're also going to go ahead and check to make sure all the parts to your knee are working well. So we're looking down here at your pulses here. Okay, let's go ahead and check the other side here. Okay, and also I'm just going to remove your shoes here. Nice toenail job there. And I'm going to go ahead, I'm going to touch here and here. Does that feel the same on both feet? Because we're checking your nerves here. And how about here? Does that feel about the same on both feet? And how about on the bottom here?
Yes.
Okay. And if you can just go ahead and push down on my hands as hard as you can, great. And now hold your feet up like this, and don't let me push that down. And then hold your big toes up right towards your nose, just like that. That's real good there. That's great. Okay. So I'm going to go ahead and push longer. You tell me if any of this hurts here. Does that hurt there at all?
A little bit.
And how about over here? And how about down here? Okay, so this up here, do you feel any pain there at all?
No.
Not at all. Okay. Now let's check out your ligaments here. That's all intact here. That's intact. That's intact there. Real good. And then we're just going to feel around your kneecap here. I'm going to have you relax your thigh muscle here just for a second here, and that's real good. And then your kneecap moves real good, not real tight. I'm going to check your hip out here, make sure that's okay here too. So bring your leg there. Okay. So I also was able to take a look at your x-rays here, and I'll go over these with you. And on your x-ray, this is a view of you standing right now. This is showing us that you do have arthritis in actually both your knees. And if we look real close, we'll see what arthritis looks like. So arthritis is where, with you standing here, this space here represents cartilage. And you can see that there's less space here. So the less space you have, the less cartilage you have. But some good things about your knee here, that we measured this angle that goes all the way up towards your hip bone and all the way down towards your ankle bone. And then the angle that makes at your knee to see how far your knee bends one way or the other. And here this shows that you're almost a straight line. You're just about 180 degrees, which is in acceptable limits. This is still showing that you have about 6 degrees of a bow here, but that's still pretty good. And the same thing over here. And if we look at this line here, we see that your knee hasn't shifted over, what's called sublux. So this is good. This means that your knee still has good inherent stability to it. Here's some views of the side view of your knee, and this is showing us your kneecap joint, and then we're going to look a little bit better at your kneecap joint here. And this is looking up and under your kneecap joint here, and we look at your left knee here, and this shows that this is pretty well centered here, but your other kneecap here is a little tight, and this is tilted a little bit. So overall, you have arthritis to your knee. But also, there's a potential that you may have a problem with your knee with a small cartilage ring in your knee that's called a meniscus. That might be torn, and that might be giving you that feeling that your knee's unstable when you go down the stairs. So in that case, I think that we might want to get an MRI of your knee. But before we get the MRI, we want to talk about the bigger issue of your knee, which is your arthritis. And with your arthritis, there are basically 2 pathways you can go ahead and take care of this arthritis.